Today, we'll be covering our brief overview on facial and glossopharyngeal nerve. I know that this was pending from a very long while because this was supposed to be covered along with trigeminal nerve because they have quite some interconnections in between. But due to time constraints, we could not cover because most of the long videos are very difficult to watch in one stretch. So I thought that I'll divide it off and I'll cover facial and glossopharyngeal nerve in this video. Hopefully we are able to cover it off. Now before I start, now you'll understand why I wanted to cover. Now before we start our facial and glossopharyngeal nerve, there are a few things I want you guys to remember from the trigeminal point. Right? Now if you remember trigeminal and oculomotor as well. Now if you remember, there was this one thing that I told you guys about. There is something known as ciliary ganglion. Ciliary ganglion, which has two nerves, that is short ciliary and long ciliary. Now, along with short ciliary, if you remember, there was a friend of third cranial nerve nucleus. If you want to know more about it, then you can watch our video on third, fourth, and sixth cranial nerve. But if you remember, there was a friend of third cranial nerve nucleus known as Edinger-Westphal nucleus, which is responsible for parasympathetic supply. Which is responsible for parasympathetic supply. What is parasympathetic? Parasympathetic is nothing but it is one of the two components of autonomic nervous system. What is autonomic nervous system? Autonomic nervous system is the component of nervous system which controls the involuntary actions of your body. Now, Edinger-Westphal is a friend of your third cranial nerve nucleus. They both send fibers. So, short ciliary and the nerve from Edinger-Westphal, they come together, supply your rectus muscles. Sorry, they don't supply your rectus muscles. They supply your pupillary muscles, that is ciliaris and sphincter pupillae, for accommodation and light reflex. So this is your parasympathetic supply. This is your ciliary ganglion. Similarly, if there is a parasympathetic, then there should be a sympathetic as well. So sympathetic is long root, is your long ciliary nerve. This is long root of ciliary ganglion. Now remember, short ciliary nerve is also known as long root of ciliary ganglion. Not long ciliary, but long root of ciliary. Whereas the long ciliary nerve itself is the sympathetic supply. To whom does it supply? Same muscles, but the action is very different. So it supplies ciliaris and something known as dilator pupillae, causes mydriasis. Causes mydriasis. So this is what sympathetic does, right? Once this much is covered, we'll move forward. Now, if you remember one more thing from your knowledge of trigeminal nerve, the trigeminal has three divisions. Three divisions are ophthalmic, maxillary, and mandibular. In the case of ophthalmic, if you remember, it gave off three branches: lacrimal, frontal, and nasociliary. Right? Nasociliary we have already covered, so we don't need to cover it again. So let's focus on lacrimal. Lacrimal nerve goes to supply lacrimal gland. Now this supply, what lacrimal does, is known as sensory supply. This is known as sensory supply. But what about the secretion part? What about the secretion part? Who gives orders to lacrimal gland for secretion? Now these orders, they come from a branch of maxillary. They come from a branch of maxillary. Now if you remember maxillary branches, We talked about maxillary branches which goes to dura. First, remove that branch. Just delete that branch right now. As soon as maxillary exits from foramen rotundum, if you want what is like to revise those concepts, you can go back to a previous video and watch it. If you remember, maxillary, as soon as it exits from foramen rotundum, it forms a ganglion in a fossa. That fossa is known as pterygopalatine fossa, and because of this, that ganglion is known as pterygopalatine ganglion. Right? Now there are ganglionic branches, there are another kind of branches. There was this one branch we talked about, and that branch was known as zygomatic branch. That branch was known as zygomatic branch. And this zygomatic branch itself was divided into ZFT, that is zygomatico-frontal, that is zygomatico-temporal, and zygomatic and ZF, zygomatico-facial. Right? Sorry. ZT, ZF. Right? Now one of these branches, they go along with lacrimal to lacrimal gland, and they give the orders for secretion, and they give the orders for secretion. One of these branches of zygomatic nerve supplies. Now the question comes, sir, like as we all know that maxillary and ophthalmic are a sensory division, then how can they give order for secretion? Now understand this way. This is your maxillary nerve. This compartment is known as pterygopalatine fossa. This is your pterygopalatine ganglion. Let's say this is a zygomatic. It's going up to supply your lacrimal gland. Now over here, there is one more foramen. Over here, there is one more foramen. And behind this foramen, there is a canal. And behind this canal, there is a nerve which is taking a turn. Behind this canal, there is a nerve which is taking a turn. So this is nerve. What it does, it sends a few fibers in this canal which come along. They go to this ganglion, and then they go along with the zygomatic nerve to lacrimal gland for secretion, for the function of secretion. This much we should know. Now this canal is known as Vidian canal, also known as pterygoid canal. And just because this nerve is passing through this canal, it is known as Vidian nerve. It is known as Vidian nerve, right? Now what is this canal? Now what is this nerve that is passing through, and why it is going like this along with zygomatic to lacrimal gland for secretion function? We'll get to know later. So as of now, we just remember there was a pterygopalatine fossa. Behind this fossa, there is a canal, and behind the canal and posterior to this canal is your nerve taking a turn, and while it takes a turn, it sends fibers. So this much we are very much clear right now. Moving forward, if you remember again, we'll go back to our previous concept. There are two concepts I wanted you guys to remember. First concept is when your mandibular nerve exits to foramen ovale. Just remember this much. If you remember, all well and good. If you don't remember, go back to a previous video and revise it. When your mandibular nerve exits to foramen ovale, just besides it, there lies a ganglion known as otic ganglion. It is known as otic ganglion, and what this ganglion does is it sends fibers to one of the branches of your mandibular nerve, to one of your branches of mandibular nerve. So what did we understand as of now? That from as soon as it exits, there is a ganglion that lies next to it known as otic ganglion. Otic ganglion sends fibers to one of the branches. Which branch? Auriculotemporal nerve. Auriculotemporal nerve. This is a branch of posterior division. This is a branch of posterior division of your mandibular nerve. So for posterior division of the mandibular nerves branch, that is auriculotemporal nerve, your otic ganglion sends a few fibers. Now where is otic ganglion is receiving these fibers? Because if, as we know from our knowledge, your parotid gland sensory supply is auriculotemporal. But who again? The question comes, who is responsible for secretion? These fibers which are coming from otic ganglion and going along with auriculotemporal as a friend to go to and talk to your parotid to tell it to secrete saliva. These fibers that are friend of auriculotemporal nerve and that is traveling along with the auriculotemporal nerve, these fibers are responsible for secretion which come from otic ganglion. And the question is, where do otic ganglion receive these fibers from? That question we'll answer today again, right? And the last is, this is your tongue. Now, as we remember from our last video, lingual nerve goes and supplies your anterior two-third of the tongue. Anterior two-third and lingual gingiva. And lingual gingiva was supplied by lingual nerve, right? And that this is your sensory supply. This is your sensory supply. Now there are two more things which your tongue does. That is movement and one very special thing called taste. Now movement is something which we will see in 12th cranial nerve video. But taste, how does it happen? For that we need to understand one more thing. There are two glands over here. One is known as submandibular gland, one is known as sublingual gland. Now along with lingual nerve we know there was a ganglion known as submandibular ganglion. Submandibular ganglion. And this submandibular ganglion receives a nerve which travels along with lingual and it supplies submandibular gland and it supplies your sublingual gland and it orders them for secretion. So we understand that lingual nerve is responsible for sensations, but this friend of lingual nerve which is coming to submandibular ganglion and then traveling along with it to these two glands is responsible for secretion. So this much we are very much clear of. Along with that, this friend that is coming, this also goes in the anterior two-third of the tongue and is responsible for anterior two-third of the tongue taste. So this friend that is coming to submandibular ganglion, traveling along with lingual nerve parallelly, goes to the two glands, supplies anterior two-third of tongue for taste. So it does two functions, secretion and taste. Secretion and taste. So I wanted these concepts to be very clear because these are very much related to trigeminal. Now I cannot revise entire trigeminal again, so I just briefly revised these concepts so that it becomes easy for us to understand facial and glossopharyngeal, right? I hope this is very much understandable for everyone. Now we'll go on to the main nerves, that is facial and glossopharyngeal. So as I told in the last video of trigeminal, facial and glossopharyngeal and trigeminal are three of the most important anatomical structures that a head and neck surgeon or a craniofacial surgeon or oral maxillofacial surgeons can encounter in their surgeries, and their knowledge is extremely imperative for everyone. Now, since they are lengthy and they are important, you cannot miss a single detail. Hence, it becomes very important for us to cover almost everything, and that's why they take a lot of time. So today we'll talk about facial and glossopharyngeal nerve. Now, when we talk about facial nerve, if you remember from our cranial nerve video, in our cranial nerve video, we talked about something that cranial nerves follow an equitable origin pattern. That is 1, 2, 3, 4 from midbrain, 5, 6, 7, 8 from pons, 9, 10, 11, 12 from medulla. So over here we know There is going to be your pons. So this is your seventh nucleus. Here is your friend, seventh friend, called as sixth cranial nerve. They lie in a very close proximity of each other. So what your facial nerve does, it doesn't follows a regular path. What it does, it goes like this, takes a loop around sixth, and then exits from the front. It doesn't exit from the back like trochlear. It doesn't decussate or it doesn't cross over. It goes in the same hemisphere. It just takes a loop around your sixth cranial nerve and then it exits from the front portion. So this is the first detail we should remember. And because of this curvature, there is a curve that is found on the posterior wall of pons. And this is known as facial colliculus. This is known as facial colliculus, which is also seen in floor of fourth ventricle. If you read about floor of fourth ventricle, you will see there is a facial colliculus that we come across, and this is what facial colliculus means. Facial colliculus is nothing but it is a kind of a bump, or it is kind of a projection that is found on the dorsal surface of pons due to bend of seventh nerve around sixth cranial nerve nucleus, right? But there might be a question that if facial colliculus is damaged, which cranial nerve will be damaged? So people generally answer facial nerve because they think that if facial colliculus, then facial nerve. But it is not facial nerve which will be damaged. Just see this. Facial nerve is just taking a turn, but it is the nucleus of the sixth that will get damaged. So you need to answer it pretty nicely and think about it with common sense that which cranial nerve nucleus is getting affected. Anyways, so we'll talk about this. Now your facial nerve has taken a turn, it is traveling forward. Now facial nerve, it travels in something known as internal acoustic meatus. Internal acoustic meatus. It comes out of it and then it takes a very sharp turn like this. And while taking turn, it forms a ganglion known as geniculate ganglion. Geniculate ganglion. So this is your internal acoustic meatus. At the geniculate ganglion, your facial nerve takes a very sharp turn and it travels laterally. It travels laterally and inferiorly. What it does traveling laterally inferiorly? There is a box over here. Now there is a box over here. This box is nothing but middle ear. Let's imagine this box as middle ear. So as soon your facial nerve, it travels laterally and inferiorly and it enters into your middle ear and it travels something like this along the medial wall superior, then it goes diagonally like this along the dorsal surface, goes this way, that is inferiorly, and it exits your middle ear, so it takes a turn, lateral turn, inferiorly it goes, enters middle ear, it travels medio superiorly in the middle ear, it takes another lateral inferior turn, goes till the dorsal surface of the posterior surface, along the dorsal surface it drops down and it exits the middle ear. Now this is very important. It drops, and then it exits the skull, or it enters the face region through a foramen known as stylomastoid foramen. Stylomastoid foramen. It exits stylomastoid foramen. It gives off branches while it goes forward. Now it travels forward and it gives off branches. There is first branch which goes to supply occipitalis with different. This goes on to supply occipitalis muscle, and the branch name is posterior auricular. Now, if you must have noticed, in some people they are able to shake their ears. They are able to shake their ears because of this muscle only. They are generally obsolete, but they can do this so very well. Good for them. Now there is this one more nerve which goes inferior to it. This is for muscle known as stylohyoid muscle. Stylohyoid muscle, and the nerve's name is also the same. And lastly, it gives off another branch for posterior belly of digastric. So if you remember, anterior belly of digastric was being supplied by a nerve of mandibular origin or mandibular nerve origin, that was the nerve going to anterior belly of digastric and mylohyoid, which was part of the posterior division of the mandibular nerve. I hope we remember because we study a lot. Then it goes forward and it enters a gland known as parotid gland, and at the level of parotid gland it divides. So one is known as, the first division is known as temporal nerve, and these are the facial branches of facial nerve. So this is known as temporal nerve, this is known as zygomatic nerve, this is known as buccal. Buccal itself is divided into two, upper buccal and lower buccal, which supply a buccinator and responsible for its movement. Now if you remember, there was a long buccal nerve which was piercing the buccinator but not supplying it, whereas this is the muscle buccal branch of your facial nerve. This supplies buccinator for movement. Then there is your another nerve, marginal mandibular, which is very important nerve in surgical dissections. And lastly, there is a cervical nerve, which supplies your platysma muscle, which supplies your platysma muscle. And these branches, they supply facial muscles of expression. So this much we are very much clear, right? Now there are some branches that I've left out. We'll cover them right now. Now while taking this turn, if you remember, we just revised before starting this lecture that there was a canal. Ahead of this canal was a fossa known as pterygopalatine fossa. So this branch which travels and enter into this canal known as Vidian canal, known as Vidian canal, is a branch of facial nerve only, and that nerve is known as greater petrosal nerve or greater superficial petrosal nerve. Greater superficial petrosal nerve. So greater superficial petrosal nerve is the nerve that is responsible for secretion of your lacrimal gland, because it goes, then it travels along with zygomatic, then it goes to lacrimal gland, and then it asks lacrimal gland to secrete salivation. Now you might ask, sir, like how can a nerve which is responsible for movement in muscles do the salivary secretion also? So the thing is, facial nerve is not just made up of one nucleus, it is made up of many nucleuses in the same pons region. So this is one nucleus. Another nucleus, there is this funky nucleus known as nucleus of, there is this funky nucleus, we'll draw it in different color so that it's clear. There is this funky nucleus over here which also, whose fibers also travel along with facial nerve. So its branches go like this over here. first, and this nucleus is known as nucleus of salivation or superior salivatory nucleus. Superior salivatory nucleus. Now one more nucleus is there which also sends signal along with this. Let's draw it in pink. He also sends his fibers along with this now. He also goes like this, and this, and go over there. Now remember one more thing over here. When greater petrosal nerve sends its fibers, over here, they not only go to lacrimal gland, but they also, if you remember, there was a ganglion over here known as pterygopalatine ganglion, which supplies your nasal mucosa, palatal mucosa, pharyngeal mucosa and all. So these greater petrosal also sends fibers along with nasal mucosa, palatal mucosa, pharyngeal, and for minor salivary gland secretion they are responsible. And they are also responsible for salivary secretion for minor salivary glands which are present in nasal mucosa, palatal mucosa and pharyngeal mucosa, which is part of the pterygopalatine ganglion, and it receives the supply through the Vidian canal from the greater petrosal nerve, which is a part of facial nerve. And we are clear about how the salivation works for these regions. Right? Moving ahead. Now these three fibers, one of superior salivatory nucleus, which is responsible for salivation, obviously. Now there is one more fiber which we talked about, pink color fibers, which are coming like this. These fibers are known as, coming from a nucleus which is known as nucleus of tractus solitarius, and this nucleus is responsible for taste. So these fibers go in the same canal along with greater petrosal. They go to these mucosa and they go to these mucosas also. So there are some of the taste receptors which are present in, let's say, your nose, or let's say in your pharynx region. They are because receiving taste sensation only because of some traces of fibers that are coming from nucleus of tractus solitarius that comes to greater superficial petrosal through the Vidian canal, which is a branch of facial nerve. Now we know it. Anyways, so now this nerve, as we descend down the video, it gives off a branch just before it exits. So there it comes, blue fibers and pink fibers. And this branch that is made up of all three fibers is known as chorda tympani. Chorda tympani. Now what does chorda tympani do? Chorda tympani travels forward and it goes to a ganglion known as submandibular ganglion. And it goes along with a friend of its known as lingual nerve, and it does two jobs. If you remember, we just revised two jobs right now, what lingual nerve does. Now we'll see what those two jobs are, and we know who are doing it. So lingual nerve does two jobs, that is secretion from submandibular gland and sublingual gland. That job is being done by chorda tympani through submandibular ganglion via these secretory fibers. So these secretory fibers they go like this, and they're responsible for secretion. But there was this one more job that we saw, that your anterior two-third taste, and that anterior two-third taste is being done by through submandibular ganglion via lingual nerve through chorda tympani. So chorda tympani is responsible for taste from anterior two-third of tongue, secretion from submandibular gland and sublingual gland, right? So now we know what are the taste and secretion from the tongue, and we are very much clear about it. So anterior two-third of the tongue, if we talk about anterior two-third, general sensation, mandibular nerve, that is lingual. Taste sensation, chorda tympani, that is facial nerve. And this is how we have covered our facial nerve. This is how we have covered the most important aspects of our facial nerve. I hope everyone is very much clear about it. Now we'll see one more thing. Just because we are talking about facial nerve, we'll cover one more thing. Let us say there is a lesion at the level of hair. What will it affect? It will affect all the facial branches, which will lead to ipsilateral facial nerve palsy. Okay, so we'll do one more thing. We'll go a little up and we'll see what it does. Let's say it affects at the level of hair, where chorda before chorda tympani exits. So it will affect chorda tympani. So this features will be there. Along with that, chorda tympani will also get damaged. So there will be no taste and decreased secretion, right? Let's say, and one more branch. Oh, such an important branch, I forgot. There is one more branch which exits before chorda tympani over here, but it goes inside inner ear. This branch is known as stapedial nerve. Stapedial nerve. And this stapedial nerve is responsible for something known as stapedial reflex. That is dampening of sounds. That is dampening of sounds. So basically what happens is when a sound wave comes to and hits your ears, it might be very loud sound, it might be a very low sound, or it can be anywhere in between frequencies. So in those kind of cases, it's your stapedial, your eardrums joins to regulate those voices, and that is because of your stapedius muscle, and that stapedius muscle is being supplied by stapedial nerve, and because of the stapedial nerve, stapedial reflex works. Your stapedius muscle is able to damp the sounds or regulate the sound waves, right? So if there is a lesion above the stapedial nerve or the nerve to stapedius, then your stapedial reflex will get damaged and there will be no dampening of sounds. And similarly, if there is a lesion above geniculate ganglion, then all these features will be there. That is ipsilateral facial palsy, chorda tympani damage, stapedial damage. Along with that, there will be loss of secretion from lacrimal gland, also known as dry eyes, plus nose, pharynx, palate will also get dry. So here we have covered almost all the concepts associated with facial nerve. Now we'll move on to the next cranial nerve, that is glossopharyngeal. So I'm not rubbing this off, I'll just go down. I hope I have a lot of space. Okay, we don't have a lot of space, so we'll create one more page. Here we will talk about glossopharyngeal. Here we will talk about the ninth cranial nerve, or something known as glossopharyngeal. Right? So when we talk about glossopharyngeal nerve, there is one thing that I want to cover before it. That okay, just minimize this here. So there's one more thing that I want to cover it. First is glossopharyngeal is known for a very important reflex in our body, and that reflex is known as gag reflex. So the thing is, when you, let's say, when you try to touch your soft palate, suddenly a gag comes. So it is because of glossopharyngeal nerve, or partly because of it. Any gag reflex, or for that matter of fact any reflex, involves two things: afferent and efferent. Now what is afferent efferent? Just remember it like this: any nerve coming towards the brain is known as afferent. Any nerve going away from the brain or from the brain is known as efferent. So if anything is coming towards the brain, it will bring some sensation. So afferent fibers generally are of sensory nature, such as taste or general sensations, whereas efferent will always be some form of order. So it will be either secretion or muscle movement or muscle movement. So we are clear, afferent means towards brain, efferent means away from the brain. Now, any reflex will involve an afferent as well as an efferent. Now, what is the afferent nerve in the case of gag reflex? The afferent is ninth cranial nerve. So, who is the efferent? 10th cranial nerve. 10th cranial nerve, 11th and 12th we'll see in the next video. But as of now, you just know that ninth cranial nerve is partly responsible for your gag reflex, right? Moving forward, now we'll start off with ninth cranial nerve. So once again, I'll remind you guys, we talked about the equitable origin of cranial nerves. 1, 2, 3, 4. 1, 2 are different. 3, 4 from midbrain. 5, 6, 7, 8 from pons. 9, 10, 11, 12 from your medulla. So this is medulla. Sorry, medulla. And medulla has the nucleus known as ninth cranial nerve nucleus. And ninth cranial nerve comes out and it just drops. It suddenly drops, and it drops and exits the skull through a foramen known as jugular foramen. There are two more cranial nerves which exit through jugular foramen, that is 10th and 11th. That is 10th and 11th. Anyways, so now we know that ninth exits through it and it gives off a branch. This branch goes and it goes inside a box. This branch goes inside a box. This box we talked about in facial nerve also. This box is known as middle ear. If you remember, your facial nerve was coming like this, and doing all that circus. But what ninth cranial nerve does is this branch comes, it enters through the floor, and it forms a plexus in the center of the middle ear. This plexus is known as tympanic plexus. Tympanic plexus. This nerve that is going like this is known as Jacobson's nerve. Jacobson's nerve, also known as tympanic branch of ninth cranial nerve. Now, to supply your ninth cranial, sorry, to supply the middle ear of sensations, it is a job of your ninth cranial nerve. So, facial nerve is just doing all this circus to gives off a branch, but it doesn't do anything special inside your middle ear. It just divides here and there and it just goes. Whereas ninth cranial nerve is the nerve which is responsible for supplying your middle ear of sensations. At the same time, it forms a plexus to supply, obviously, and then this plexus also gives off a branch which exits like this, and now if you remember, we talked about mandibular nerve coming out like this. We talked about a small ganglion near mandibular nerve. This ganglion was known as otic ganglion, and this otic ganglion is being supplied by this nerve that is known as lesser superficial petrosal. Lesser superficial petrosal. And these fibers come from a friend of ninth cranial nerve who is known as inferior salivatory nucleus. Inferior salivatory nucleus. So these inferior salivatory nucleus sensor fibers They don't do anything in tympanic plexus as such. They just go along with lesser in the form of lesser superficial petrosal. They go to otic ganglion and then they join your mandibular nerve. Mandibular nerve has two branches if you remember. Anterior division, posterior division. Posterior division has a branch called auriculotemporal which goes to your parotid. Now auriculotemporal does sensations, whereas these lesser superficial petrosal fibers, they go to otic, they go along with mandible, posterior division, auriculotemporal, go to parotid gland, and they tell parotid gland secrete for us. They tell parotid gland or they order parotid gland to secrete. So secretions from lacrimal gland, submandibular gland, sublingual gland by facial, secretions from parotid by ninth, that is glossopharyngeal. So now we know, and that is through inferior salivatory nucleus. So the origin of secretion from my submandibular, sublingual and lacrimal is from superior salivatory nucleus. But the only gland which is not associated with seventh or superior salivatory is parotid, which is being supplied by inferior salivatory through ninth cranial nerve, and we know this. Anyways, so since we have talked about lesser superficial petrosal, tympanic plexus and tympanic nerve, we'll go forward to see the other branches. Now your ninth cranial nerve is almost sensory except for one branch, this one, which supplies a muscle known as stylopharyngeus. Now this is the only motor function of your glossopharyngeal nerve. Rest everything is sensory. Rest everything is sensory except for this muscle. Then it goes on to supply something which you people have already read. Now if you remember, I talked about anterior two-third of tongue. So anterior two-third sensation was lingual nerve. Taste was facial nerve through chorda tympani. What about the posterior one-third? So posterior one-third, taste plus general sensation, both are by your ninth cranial nerve. Both are by your ninth cranial nerve. And one more thing, it also sends fiber to your palate, pharynx, tonsils for sensations. And then last job that we have just studied, it also is responsible for carotid sinus. It gives off some fibers to carotid sinus, which is responsible for reflex. Now what is carotid sinus? Carotid sinus is a baroreceptor, whereas carotid body is a chemoreceptor. Now these two are baro and chemoreceptors, and they induce a reflex which is responsible for regulation in your blood, for BP and all. So your ninth cranial nerve is responsible for this reflex also. So it's responsible for gag reflex and these reflexes as well, right? So it does secretion sensations, it does taste plus gag, is taste plus general sensation for posterior one-third of the tongue. It gives motor supply, the only motor supply, and it gives off a branch which goes to form a tympanic plexus. This tympanic plexus gives off a branch known as lesser superficial petrosal, which goes to otic ganglion, and through otic ganglion it goes to mandibular nerve to posterior division to auriculotemporal, and along with auriculotemporal it reaches parotid gland and causes secretion. And hence we have covered our glossopharyngeal nerve as well. And hence we have covered our glossopharyngeal nerve as well. And this concludes our 5th, 7th and ninth cranial nerve video. I hope I have cleared almost everything. So at the end of the day, I would like to tell, stay curious, keep learning, and our JC videos are going to come soon. So stay tuned to them also as well. Thank you. Have a nice day. Goodbye.